Hello, Miss Alice. I'm Aliyah Pagdidigan, your student nurse for today. For today, we're gonna assess your head, eyes, nose, mouth, ears, and neck. Shall we start, ma'am?
Yes, ma'am.
So first, Miss Alice, I will gonna inspect your head and hair. So it's okay to you that I will touch your hair. Okay. No dandruff, no lice, no lichens, or any scars. So your head seems to be normal. So I'm gonna palpate your head and tell me if there's any pain. There's any pain here, ma'am? How about here? So the patient head is normal. The hair is smooth to touch. No dandruff, scars, or any line. And now, we are going to proceed to assessing the face of the patient. So, the palpebral features seems to be symmetrical and normal. So, ma'am, could you smile for me? So, the presence of nasolabial folds are present and symmetrical to the both right and left side. I'm gonna proceed to inspecting and assessing your eyebrow. Seems to be symmetrical on the both left and right side. Can I touch it? Yeah. So the distribution of the hair it seems to be even and normal on your both eyebrows. So the patient's eyelash is evenly distributed on the both sides. Can I touch your face, ma'am? So it seems to be symmetrical on the both sides. Please close your eyes tightly and then open them up for me, ma'am. Open them up. So the patient is not troubling to opening and closing the eye. The eyelid is covering the part of the sclera which is normal. Now we are going to continue to assessing the palpebral conjunctiva. Can you look down for me, ma'am? Blink your eyes, ma'am. Now the other side. Blink. Okay, there's no swelling, no presence of foreign object, and no pain that felt by the patient while I do the palpebral conjunctiva. So now I will going to palpate the lacrimal glands of the patient. Can I touch your face, ma'am? So there's no swelling. The lacrimal glands of the patient is normal. Next is the nasolacrimal glands of the patient. Can I touch your face here, ma'am? Yes, sure. Do you feel anything? Nothing. So the patient feel no pain and no presence of swelling. So now I will proceed to assessing the conjunctiva of the patient. Ma'am, I will touch your face again. Please look up. So the conjunctiva of the patient seems to be no foreign bodies and no any type of swelling. In short, the conjunctiva of the patient is normal. Now is for the sclera and cornea of the patient. The sclera of the patient is perfectly normal on the both left and right. There's no abnormalities with the cornea of the patient both left and right side. So the sclera and cornea is normal. We are gonna proceed to assess the iris of the patient. The iris of the patient is in dark brown in color. It's the same size. So the normal size of iris is 10.2 to 13 mm. Let's proceed to checking the construction of the patient pupils. Ma'am, I'm gonna check your eyes again. I'm gonna shine a light on your eyes. Is it okay? So look at the object right there. I will start now. The other side. So the pupils, the patient pupils is constricting and it is normal. So now we are gonna check the accommodation of the pupils. So ma'am, I'm gonna shine a light on your eyes again. Just gonna look at that object again. Look straight ahead. The both pupils is still constricting to the light, and the both left and right of the pupils is responsive to the light. And now, ma'am, I want you to focus at my finger as I light your eye, okay? Just focus at my finger, ma'am. So the pupils are still contracting and active to the light. So it is normal. It has accommodation and reactive to the light. So what I'm gonna do, I will show a finger on the side while your one eye is covered. It starts to cover your right eye. 1, 2, 4, 5. Cover your left eye. 1, 2, 5, 4, 3, 1. Okay, tapos na po, ma'am. So, the patient identify how many fingers they are. Now, I proceed to assessing by your ears. I will see if your ears is level by the side of your eyes. So, the pin of your ears is almost level by your eyes. Now, we are going to palpate the cartilage in the mastoid process of the patient. Do you feel anything pain, ma'am? No. Okay, so there is no swelling on the cartilage of the patient. Next is the mastery process. Do you feel anything, ma'am? No. How about tenderness? No. So the cartilage and the mastery process of the patient is normal. So now we're gonna assess the patient ear canal and the tympanic membrane. Can I touch your ears, ma'am? The ears of the patient and the ear canal of the patient is same color with the ears of the patient. There's no foreign body, there's a cerumen or wax, which is totally normal. Now we proceed to assessing the patient nose. So the patient nose is in the middle of the face or in the midline. So there's no deviation to the left and right. Septums is normal. Nostrils is normal. So now, ma'am, please occlude the side of your nostrils. Inhale. Okay. Did you have time of breathing, hard breathing, ma'am? The patient breathes perfectly normal, even the one side is occluded. There's no obstruction in the nose. So now we're gonna palpate the patient external nostrils or nares. Do you feel anything, ma'am, while I touch it? Okay, the patient with mouth and lips. Can I touch your face, ma'am? So the patient lips is symmetrical. There's no lesion, no bleeding, no edema, or any type of problem. Can I touch your lips, ma'am? So the patient lips is soft and smooth. Checking the patient's mouth. Could you smile for me, ma'am? Open your mouth, please. So the patient teeth is 28. The dominant color is white. There's no malocclusion. To check the patient uvula. Can you say, ma'am, are you long? The uvula of the patient is vibrating and moving when she says, The uvula of the patient is pinkish color. There's no swelling of the both tonsils and uvula. So last is assess the patient's neck. Can you bend your neck to your shoulder, ma'am, both left and right? Can you do it, please? There's any pain? No. So the patient can do it effortlessly and there's no pain. Ma'am, bend your head forward and backward. So there are trouble when you do it, ma'am? Nothing. How about any pain? Nothing. So the patient can do it effortlessly without trouble and no pain. Next is to check the patient trachea. The patient trachea is in the middle position. There is no visible jugular vein. There is no presence of thyroid gland. The neck of the patient is normal as I expect. Patient thyroid, I'm gonna do an anterior approach. Can I touch your neck, ma'am? Okay. Do you feel anything? No. How about here? Nothing. Here? Okay. The patient feels no pain. Now, I'm gonna palpate if the patient have an enlarged thyroid. Can I touch your neck, ma'am? Please tilt your neck over. Do you feel anything? Yes, the other side. Do you feel anything? So the patient feels no pain when I check the enlarged thyroid.